Hey guys, Josh Rogers here with Men's Wellness North Alabama. Today we're going to do some testosterone injection training for at home. So this video is to cover how to take your testosterone at home, either yourself or to get someone to do it for you. At any time you have questions about how to do these injections or you need clarification, please call us at the clinic. You can schedule a time. A lot of times you can just drop back in. This video is just to augment what we've already gone over together in the meeting. So with that said, the first thing that we're going to look at is the proper storage of that medication. So the first thing that you want to keep in mind is the temperature. So testosterone is an oil-based medication, so you can store it outside of the refrigerator. You just want to keep it out of direct sunlight. And you don't want to leave it in your trucks, right? Too hot, too cold, but generally room temperature should be just fine. You can keep it in your medicine cabinet, just keep it away from children, particularly pregnant women and small children and others. So another thing to consider when storing your medication is travel. So you always want to, if you're traveling via airplane, you want to contact the airline itself and get further guidance there, but oftentimes you can travel with this medication without any particular issues. The only thing for sure is you want to travel with the actual medication with the labeled. So if it has a box, or actual label on the medication itself, it needs to be directly on there to identify like the medicine is actually yours. Okay, so let's go ahead and orient you to the equipment that you'll need. So you'll obviously need your testosterone medication. You'll need syringe. There's two different types here we'll go over. You'll need the draw and injection needle, your alcohol pads, and possibly a Band-Aid. So on the actual medication of your testosterone, if you look at the bottle, it'll say testosterone cypionate, typically 2,000 milligrams per 10 ml. So this is a multi-dose vial. So use this for multiple injections on the same one. So you will open up that bottle and you'll see on the inside, you'll see your testosterone, vial here. So there's that. Oftentimes the pharmacy is going to give you a 3 ml syringe with a needle already attached to it. That needle that's attached to it is a 23 gauge needle. You can draw up your medication and inject with this one here. Or you can switch it out. This is a 18 gauge draw needle, so it's usually pink. You don't want to inject with this one. This is way too thick to go into your skin. You'll likely bleed and it'll be painful unnecessarily. So there's also, sometimes the guys prefer a smaller needle. This is a 25 gauge and it is orange as well. We do prefer these in a lot of cases. This is a 1 ml syringe. We just like these because these are more accurate. You can really get very accurate with these, but the pharmacy doesn't always have them. So most commonly, they're going to give you one of these, which is a 3 ml syringe with a 23 gauge needle associated with it. You will need some alcohol pads, and then maybe a Band-Aid, maybe not, if you bleed, and then a sharps container. Now, with these, you can bring these to us. This is the larger one. You get this on Amazon if you want to. Or you can just simply use a Gatorade bottle, a Coke bottle. You still want to use a cheap water bottle for those needles. And the primary reason for that is we just don't want any of our trash service guys to get poked with needles because they don't know that you're not, infected with some kind of, virus or other disease. So we really want to protect them from getting poked. So those are the types of bottles you can use. And again, if you have questions about that, you can call the clinic and you can clarify with that. Okay, so moving on to where you're actually going to inject it. There's a few places that we would recommend commonly that you use for injection site. The most common and typically the most well tolerated is the upper outer hip, right? So if you take a look at that diagram that we have there, you can see basically if you take the gluteal region or your butt and divide it into 4 quadrants, you're going to the upper outer quadrant. So in layman's terms, when you're looking at the side of the mirror, you kind of flex your bottom, you'll see a dent, and right above that dent is typically a good spot to do your injection site there. The other one is the anterior thigh, so the front portion of your thigh. Again, if you look at this diagram here, this is the general location that we want you to place that. That one's typically well tolerated as well. We generally would want you to inject that in the morning. That way you're walking around all day. Otherwise, if you just tend to inject it in the evening, my quads tend to get sore, feel like a Charlie horse. But typically if you do it in the morning or within a few hours of some activity, it doesn't really bother you too much. Another common place that is well tolerated is the deltoid, so your upper outer shoulder. That's really well tolerated as well. However, in that area, the medicine does tend to extrude a little bit, so some may leak back out to a small degree, and that's just because that muscle is very tight, it's very strong, it's kind of wrapped around like a rope. But it's still a perfectly safe place to do that. At any rate, any location site that you end up doing at home or have someone do to you, is you want to alternate those locations. And the primary reason for that is you want to not build up scar tissue over time, because if you do, the medicine won't absorb as properly and you won't get the benefits of the medication. So if you have questions about that, please reach out to us and we'll clarify. All right, so let's talk about how to draw up that medication and get it ready for the injection. So first thing you want to do is confirm the prescribed dose. So you can see on the bottle here, this gives the strength of the medication. So in this case, it's a multi-dose vial. So use it multiple times. So this is 2,000 milligrams per 10 ml, so 2,000 per 10 ml, or 200 milligrams per 1 ml there. On the actual box of your medication, I won't show you mine just to protect my privacy, but it'll say directly on there, and the common doses that are often used is half an ml, 0.75 ml, or 1 ml. There are also many others, but those are some of the more common doses there. So after we've confirmed the prescribed dose, again, we're going to gather up our supplies. So we have our medication bottle here. We have the 3 ml syringe with the needle already on it. We have an 18 gauge draw needle. It's pink and large. We have some alcohol pads, and we have just a common Band-Aid if in fact that we do need that. So first thing that we're going to do is take this medication and we're going to clean the top of it with an alcohol pad. Keep in mind, as we're cleaning the top of this medication, it's not just the application of the alcohol that's cleaning, it's actually a little bit of mechanical here. And on the very top of that bottle, it needs to dry. So until that's dry, you don't want to actually spike the container quite yet. So while we'll do that, let's go ahead and remove the syringe. So just remove it all the way down and make sure that the plunger is free. We're going to use the 18 gauge needle. So we'll just take this and we'll take that out. Avoid touching the back part there. These screw on and off, so I'm just going to screw it on, screw it off, screw it on, screw it off. I'm going to switch it back. I'm going to spin this, and now it's attached. We'll just set this aside. We're going to uncap the needle. Again, you want to confirm your dose. So in this case, we're going to do 0.75. So there's you go by the bottom plunger that touches the side. So there's half an ml. There's a 1 ml, so this is a 1 ml injection, and right there is a 0.75, so that's how much air we're going to inject into the bottle. The top of that bottle is now dry, so we're going to take the needle and we're going to push it into the top of the testosterone bottle, like so, right? And we're going to push the air into there, and then we're going to pull back on the syringe until we reach the 1. There's a little bit of air in that needle still, so we're going to push it back up to that 0.75 there, and then remove the needle from the bottle. So you may notice that there's actually some medication still in that syringe. So what we're going to do is we're going to pull back on that plunger to remove the air out of the 18 gauge draw needle. And we're going to remove that needle because this is much too big to inject yourself with. So to do that, I recommend coming in perpendicular, the top, and then just dropping it. So now it's attached. You can spin that off, reattach that injection needle, and we'll just spin that all the way down, and then advance the plunger forward until just a smidge of that medicine will come to the top of that needle there to remove the rest of the air. Just like that. So now the needle is ready for injection. All right, so now we're going to confirm the injection site, mark the location, clean the area, and remove the cap of the needle, okay? So first thing we're gonna do is confirm the area. So we're gonna look at the upper outer glute. So again, 4 quadrants, upper outer quadrant, just above the dent in my rear end here. I'm gonna mark it. So I'm gonna take the needle cap with the needle still attached, right? The cap is still on there. I'm gonna actually push that into my skin, all right? And that is going to mark the site. That will stay there even after we clean it. All right, so the next thing I'm going to clean the area. Take an alcohol pad. I'm gonna start in the center of where I am. I'm gonna push down. I'm gonna move an outward growing circle. I'm gonna flip the alcohol pad over. I'm gonna do the same thing. Start in the center, not going back over where we first started. And again, I'm gonna let that area dry. Now I'm going to remove the cap of the needle like this, and now we're actually ready to do the injection. All right, so what we're going to do is I'm going to hold the needle just like this with between your middle and your thumb. I'm going to place my index finger on the top of the rim of the syringe. I'm going to take the skin, find my marked area. I'm going to not touch where I'm actually going to inject, but I'm going to pull that skin nice and tight. And with direct pressure, I'm just going to push the needle all the way in. Okay, the more direct pressure, the easier it is. So I'm going to go ahead and do it live. So I'm just going to push in. Shouldn't hurt much. Now I'm going to depress that plunger with just direct pressure, not pushing too hard, not fast, not slow. I'm just going to push that directly in as my body accepts the medicine. Okay, that plunger is all the way down. I'm just going to pull it all the way out and set the needle and syringe down. At times it may bleed, so you can simply just push a small amount of pressure right there. Just hold it there just for a minute or so, and then remove. If it bleeds, of course, you can use just a standard bandage, from there. All right, so what to do with the needle when you're done? Simply take the needle in the same fashion. You don't want to do this, right? So you just want to come at a 90-degree angle, get the tip of the needle on there. Once it's secured, you just push it down, it'll click, and then you set it aside. All right, so now we're going to talk about doing the injection site in the outer delt, the lateral portion of the delt, which is the outside. So again, we have our syringe that's already prepped with the cap on there. We're going to take our hand and make a V shape and grab our outer shoulder here. Between our index finger and our thumb is the site for injection. So again, we're going to take the needle with the cap still on there, and we're going to push that into the skin where it'll mark it, right? So now that it's marked, we're going to clean the area with the alcohol pad, starting in the center and working in an outward direction, trying not to cross where we've already cleaned. Flip the pad over and do it again. Allow it to dry just as we did. We're going to remove the needle, setting the cap to the side. We're going to hold it between the middle finger and the thumb, with the top on the lip of the syringe. Again, you found it directly. You won't be able to hold it taut with the hand is a little bit different with this one, but just add in direct pressure. You push it all the way in to the right portion of the needle. You're gonna push the plunger down nice and smooth and slow. Push it all the way down, and then you can remove the needle. This one may extrude a little bit more, so just set the needle down and then place your finger on there. The same thing if it bleeds slightly. Just push a small amount of pressure for a short period of time, somewhere between 2 and 3 minutes. If necessary, then you remove that. You'll want to recap the needle. So You'll take the needle, the cap, move it 90-degree angle. You'll hear a click, and now it's ready to be disposed of. All right, so now we're going to talk about doing the anterior thigh, another perfectly safe place to do in an injection. A few more considerations for this area is you want to keep it in the center of the thigh, somewhere here. So the general landmarks is going to be the outer portion. So you're going to place one hand just above the knee. So you're between here and one hand right at where your leg meets your hip, right through here. So somewhere between this area here is perfectly safe, preferably more towards the outside, but not all the way on the side of your leg. So once we've identified the site, we're going to take the needle that's capped again. See, the needle has a cap on there. We're going to mark the site. So we're just going to push the needle into the area. It's going to leave a little ring, and we'll take it out. Again, you'll take your alcohol pad. You place it in the center. Circles on the outside, applying some pressure. You'll flip it over. Again, cleaning the entire site, letting it dry. You're gonna then uncap your needle. You're gonna hold the skin taut with your fingers, just gonna pull the skin apart with and then with direct pressure, push the needle all the way in to the white, push down on the plunger completely, pull it out, place the finger on that area if it bleeds slightly, just for a short period of time. You'll take this needle here, and see, I'm used to it. I shouldn't do that probably, but you'll take the needle here, 90-degree angle, place it down, and it'll click, and you can set it aside. All right, so your shots are now done. So there's a few things to keep in mind for afterwards. So one, you want to dispose of the needle in a way that protects anyone in your house and anyone that's dealing with your trash. So again, you want to put that preferably in a sharps container, which you can just purchase. They typically have them at your pharmacy. You can place them in a Gatorade bottle or a Coke bottle, or something that's thick plastic. You can also use a laundry detergent bottle, is also fine. It's just make sure that the cap will completely seal, and you're welcome to bring that to the clinic, and we'll deal with it for you. This is a sharps container. These are similar ones we have in the office, but they all work very similar. They work by a lever, and they're meant to prevent you sticking your hand into them. So after you're done with your injection, you throw those in here and you just place it aside there, and it'll close that way. All right, there's a fill line there, so don't fill them up beyond that point. And once they're full, these will completely close off and they'll be ready for disposal. So when you're done, there you go. The next thing is you just did an injection, so it is a possibility that you can get an infection. What are the signs of infection? So you're gonna have redness, swelling, pain, and you may get somewhat feverish, okay? If that's happened at all, or you have any concerns about that, please contact the clinic. You can call, text, or just stop by. We'll want to evaluate that when it's can. The injection site infections are very rare, but they do happen from time to time. So please keep in contact with us, and we'll make sure those are taken care of. And again, if you have any more questions, concerns related to this injection, or you just want in-person training, or you want someone that's doing your injections to be trained, you're more than welcome to bring that by or schedule that with us, and we'll make sure that training is completed.